The United States has a long history of welcoming refugees from all over the world. In recent years, the number of refugees fleeing war and persecution has increased dramatically. Many of these refugees end up homeless on the streets of American cities. According to a 2019 report by the National Alliance to End Homelessness, refugees make up about 20% of the street homeless population in the United States. This is a significant increase from just a few years ago. The demographics of the refugee homeless population are similar to those of the overall homeless population. The majority of refugees who are homeless are male, and they are more likely to be single than the general population. They are also more likely to have mental health problems and substance abuse disorders. There are a number of factors that contribute to the high rate of homelessness among refugees. One factor is that refugees often have difficulty finding affordable housing. They may also have difficulty finding jobs, which can make it difficult to pay for housing. Additionally, many refugees have experienced trauma and loss, which can make it difficult to cope with the challenges of homelessness. There are a number of ways to prevent refugees in the USA. One way is to address the root causes of refugee flows. This includes working to end conflict and persecution in refugee-producing countries. Finally, the US can also work to prevent refugees from entering the country illegally. This can be done by strengthening border security and working with other countries to combat human trafficking. Age demographics of the street homeless population in the USA. The age demographics of the street homeless population in the USA are changing. In the past, the majority of homeless people were young adults. However, in recent years, there has been a growing number of older homeless people. This is due to a number of factors, including the rising cost of housing, the decline of affordable housing, and the increasing prevalence of chronic diseases among older adults. According to the National Alliance to End Homelessness, on a single night in January 2023, there were an estimated 582,462 people experiencing homelessness in the USA. Of those, 340,000 were adults aged 25 or older. This means that over half of the homeless population in the USA are middle-aged or older adults. The number of older adults experiencing homelessness has increased by 11% since 2020. This is a significant increase, and it is likely to continue to grow in the coming years. There are a number of factors that are contributing to this trend, including the rising cost of housing. The cost of housing has been rising faster than incomes in recent years. This has made it difficult for many people to afford housing, especially older adults on fixed incomes. The decline of affordable housing. The supply of affordable housing has been declining in recent years. This is due to a number of factors, including the conversion of rental units to condominiums, the demolition of older buildings, and the lack of government investment in affordable housing. The increasing prevalence of chronic diseases among older adults. Chronic diseases, such as diabetes, heart disease, and cancer, are more common among older adults. These diseases can make it difficult for older adults to work and maintain a stable income. Gender demographics of the street homeless population in the USA. According to the National Alliance to End Homelessness, men make up the majority of the street homeless population in the USA, accounting for about 60.6% of the total population. Women make up about 39.1%, and transgender and gender non-conforming individuals make up the remaining 0.3%. There are a number of factors that contribute to the gender disparity in homelessness. One factor is that men are more likely to experience poverty and unemployment, which can make it more difficult to afford housing. Men are also more likely to be victims of violence and crime, which can lead to homelessness. Additionally, men are less likely to have access to social support networks, which can help people stay afloat when they experience financial difficulties. Women who are homeless are more likely to face unique challenges, such as domestic violence, sexual assault, and childcare issues. They are also more likely to be victims of crime and exploitation. Additionally, women who are homeless are more likely to have children, which can make it even more difficult to find and maintain housing. Homelessness can have a devastating impact on people's lives, regardless of their gender. It can lead to poor physical and mental health, increased risk of victimization, and difficulty finding and maintaining employment. It is important to address the gender disparity in homelessness in order to ensure that everyone has access to safe and affordable housing. Here are some specific challenges that women who are homeless may face: domestic violence. sexual assault, childcare issues, victimization and exploitation, lack of social support networks. The challenges that men who are homeless may face: poverty, unemployment, victimization of violence and crime, lack of social support networks. Race and ethnicity demographics of the street homeless population. Homelessness is a major issue in the United States, and racial and ethnic minorities are disproportionately represented among the homeless population. According to a 2022 report by the National Alliance to End Homelessness, African Americans make up 40% of the homeless population, while Hispanics make up 29%. Native Americans and Alaska Natives are also overrepresented, accounting for 8% of the homeless population. There are a number of factors that contribute to the racial and ethnic disparities in homelessness. One factor is poverty. African Americans, Hispanics, and Native Americans are more likely to live in poverty than white Americans. Poverty can make it difficult to afford housing, and it can also lead to other problems that can contribute to homelessness, such as job loss, mental illness, and substance abuse. Another factor that contributes to the racial and ethnic disparities in homelessness is discrimination. People of color may face discrimination in the housing market, making it more difficult for them to find and keep housing. They may also face discrimination in employment and other areas of life, which can make it difficult to overcome the challenges that can lead to homelessness. One of the biggest challenges faced by street homeless people is a lack of access to basic necessities, such as food, water, shelter, and healthcare. Many street homeless people have difficulty finding a place to sleep at night, and they are often exposed to extreme weather conditions. They may also have difficulty accessing food and water, and they may not be able to afford basic hygiene supplies. Health problems. Street homeless people are at an increased risk for a number of health problems, including mental illness, substance abuse, and infectious diseases. They may also have difficulty accessing healthcare services, and they may not be able to afford medications. Victimization. Street homeless people are also at an increased risk of victimization, including violence, crime, and harassment. They may also be targets of discrimination and prejudice. Lack of social support. Many street homeless people lack social support from family and friends. This can make it difficult for them to cope with the challenges they face and to get back on their feet. Challenges to employment. Street homeless people may also face challenges to employment. They may not have a permanent address, and they may not be able to afford transportation to and from work. They may also have difficulty finding employers who are willing to hire them. Government policies. Some government policies can also make it difficult for street homeless people to get back on their feet. For example, some cities have laws that prohibit people from sleeping in public places. These laws can make it difficult for street homeless people to find a place to sleep at night.